if you're among those who experience knee pain, or if you have ever experienced knee pain. Knee pain is very common among very active people. If you are very active, you agree with me that you must have experienced knee pain once or twice during your activities or in your life. So in this video, we're going to talk about knee pain, the causes, and how to stop it. There are really simple things we can do at home to stop this knee pain and get relieved. Hello, welcome to my channel. My name is Queen, and please remember to subscribe. Just hit the subscribe button and hit the notification bell. That way you'll be able to receive notification each time I upload a video. Thank you. If you want to know how to manage knee pains when you experience it, you're able to manage it and then get relieved, do watch the end of this video. And when you experience knee pain or any other condition for days, it's always good to see your doctor for proper checkup and management. So let's get started. What is knee pain? We all know where our knee is. Okay, so it is usually the pain we feel in our knee, and this can be as a result of so many factors ranging from medical to non-medical cases. Ranging from strain, sprain, fracture, tear of ligament, overuse, wear and tear, bursitis, arthritis, that's a very common word, arthritis, gout, and so many other causes. In fact, just check the description box. I'm going to leave the causes of knee pain. There are different causes of it, so I'm going to leave its causes for you to go through it. I don't want us to spend the whole day listening to this. Each type of knee pain has its specific signs and symptoms, but generally knee pain is just feeling a pain, kind of discomfort in your knee, which is usually characterized by pain and swelling. So you check the description for more details on the types and signs of different types. For instance, the pain we feel between our knee and our shin, and is usually exacerbated, get worse when you jump or you're running. That is as a result of tendonitis. So there are different signs to identify which type of knee pain you have. So see the description for this. Talking about how to prevent this knee pain. Generally, most common knee pain are as a result of overuse, okay, and improper use, or even using wrong equipment. In fact, I'm just gonna list them for you. It can be as a result of improper use of equipment, improper positioning, when you're not on an even ground, like you're not considering the floor of where you're walking, overweight, lifting a lot of weight, and taking some positions that are improper, and engaging in some physical activities, like activities that involve contact. And it can also be trauma, maybe when something hits your knee or you hit something in your knee. Oh, that's so painful. I've experienced that once. Not once anyway. When I was in a tricycle going to somewhere, and then unfortunately we encountered a bad road, somewhere bad in the road, and then I hit my knee on the iron. It was so painful. In fact, personally, I've experienced it over and over again, and I have this serious knee pain, but then I managed them. That's enough about me. So knee pain is usually as a result of injury to the knee. It can be to the cartilage, to the muscle, to the tendons, even to the sac. That's the liquid, the sac containing the liquid. So this can be the causes of knee pain. And then there are other causes like osteomyelitis, that's sepsis, infection to the bone, arthritis. Arthritis is usually a wear and tear effect when there is no cushion between the bones, so they kind of override on each other. And then gout. And Fracture is, oh, I can't imagine fracture. So come on guys, these are the causes of knee injury. So let's go to how to manage this condition, how to manage our knee pain. I play volleyball and I experienced knee injury during the course of playing this ball. Of course, I usually experience knee pain while playing. So you experience this knee pain. Of course, there are things I do. There are things you can do to stop it. They include rice, massage, and I'm gonna mention them. You're surprised I say rice. I don't mean you should eat rice. It's just an acronym. So you kind of rest. You have to rest it. So resting it means staying away from activities that may strain your knee, away from playing balls, running, jogging, all those activities, using staircase for a long time, for a long distance. You have to rest your knee, and then you stop squatting. You stop squatting, deep squatting, and kneeling down, all those activities that stress our knee. So you have to rest it. I means ice. So it's proper to apply ice pack to your knee. So it's not right to just put ice on your knee. So just wrap it in a cloth and then put it on your knee. You should leave it. You should just apply it intermittently for between 5 minutes, 10 minutes. You remove it, put it 5 to 10 minutes. You just remove it, put it, remove. You keep changing it, and then you give yourself time, and then you repeat it. Then C means compression. So you see a lot of people tying bandage. In fact, during the course of playing volleyball, you see a lot of people tying ankles, knee joint. They tie themselves like Lazarus. Anyway, just a way to prevent this injury. So for them, so compressing too is a way of treating this knee. That is why most people who have pain in their knee, you're likely to see them tying bandages in their knee, or a sort of clothes, or just something to keep it firm and steady. And then the next one, E, elevation. So it's good to once in a while elevate your legs. You just put it on a stool, put it on the bed, rest it. When you do these things, you also have to massage it. You have to massage your knee properly. Yeah, massaging it depending on the type of injury you have anyway. So massaging it kind of relieves the muscles around it and all those ligaments. When you apply these things, if it's ligament, you are supposed to start having a kind of relief. But if you don't feel any better, see your doctor. You can also take analgesics, that's pain relief. But it's actually nice to consult your doctor before taking medicines. But you can take some minor pain relief like paracetamol. At least that is a minor one and simple. It can help. You can also apply cream depending on its prescription. So all those topical analgesic, you can also use it to massage it. In general, that's what we do most of the time. So what are the ways to prevent this injury? Sometimes we put ourselves at risk of getting this knee injury. Yes. So why will you start exercising without warming up? I mean, you really need to warm up. Exercise, do a warm up. That way you'll be able to, get yourself ready, get every part of your body ready, not just your knee. Carry a load that is proportional to your strength. I mean, why will you want to lift weight? Why not start gradually? Carry something you can be able to contain. Carry something that you can carry. Stop putting so much weight on yourself, and minimize the way you squat. While squat, even if you want to squat, minimize the loads you put on yourself. Also, when lifting weights, I mean, there are proper way of lifting weights. So we should try to take up the good practice, the normal way, the proper way of lifting weight to avoid injury. Consider your environment, consider your surroundings. You have a safe playing environment, like avoid slippery grounds, avoid uneven floor. Those things. You should be able to consider the safety of your environment, and then you should know how to use equipment properly and avoid overuse. I mean, sometimes we put ourselves at risk. Avoid overuse. For instance, if you are lifting weight, if you are squatting, it is wise to take a day off. You shouldn't do that every day. No wonder gyms closes on weekends. You should take a day break. You should take a day off. It's really important. Also, take a lot of fluid. You should take a lot of fluid. It really helps. And the next thing you should do is to eat properly. You should take proper food and vitamin D or calcium supplements to avoid osteoporosis. Knee pain can be a sign of osteoporosis. So, and the last but not the least, work on your weight. Overweight is a predisposing factor for knee pain. So if you're overweight, try to cut down your weight, try to reduce your weight. It mustn't be drastic, but I'll show you, losing 1 kg, 2 kg in a month will really go a long way to help you relieve pain on your knee. And the next one, okay, the last one, you should consider your footwears. Sometimes our footwears really makes it worse. Like they make it worse for us. So you consider your footwear, wear something soft, something you can endure, something that allows free movement. And when you put all this into consideration, I'll show you, you'll really be able to manage your knee pain and also prevent reoccurrence. Thank you for watching to this end. Please remember to subscribe and hit the notification. If your pain persists, please endeavor to see your doctor. Do not self-medicate. Just see your doctor.